And good morning, everyone. For those who may have joined late, I'm Rutika Mehta. I'm a GI medical oncologist at Moffitt. My clinical and research focus has been gastroesophageal cancers. So I'll be discussing about clinical trials in gastric cancer or clinical trials in general to help navigate patients as to when would be the right time to look for clinical trials. What is a clinical trial? Is a particular clinical trial appropriate for me? These are my disclosures. Um, so I think the very first question that I get asked is, what is a clinical trial? A clinical trial could be one of many things. As a medical oncologist, the most common type of clinical trials that I have to offer is an experimental therapy, either by itself or in combination with something that is already standard practice. But that combination may have not been FDA approved. So we're trying to see whether the combination is safe, whether the combination is effective, or whether the combination of the drug itself works better than what's already approved for your cancer type. So that goes to say, are all trials same? No, all trials are not the same. There are different phases of clinical trials. You have a phase one where I just mentioned about efficacy or safety of the drug. Phase two is where you're looking at the efficacy of the drugs. And phase three is when you're comparing that to your gold standard treatment. Some trials are focused for just your cancer type. So you might see trials that are particularly just for gastric cancer. But there are some trials that could be more generic, which means can be given for different cancer types. How does one choose what's the best clinical trial for them? Now, researchers and physicians do always appreciate your contribution to research as participants of clinical trials. But what's important is to talk to your physician. Talk to, you found a clinical trial, maybe somebody told you about a clinical trial, you heard from a support group, or you were browsing on clinicaltrials.gov, or you were browsing on DDF website and you came across a clinical trial. Please talk to your physician about it. It also depends on when you are looking to enroll into a clinical trial. You have been newly diagnosed with cancer and you want to say, no, I probably want to go something with that's not traditional, or have you been on different treatment types and those treatments have not been working really well and therefore you would like to try something new? Participation is always voluntary. So if you say you participated in a clinical trial, you're on a clinical trial and you just don't feel that it's working for you, you can always withdraw participation. Um, and also understand that not all places offer the same trials. So you might have to travel if you're really interested in a particular trial. You might have to travel long distances. So do factor in, accommodation, travel, your time spent, etc. Why are trials so important? Dr. Sharif just mentioned about, HER2 positive PD-L1, the variety of drugs, the variety of biomarkers that we're looking for. All this would not have been possible if we had not done clinical trials. So you see a bunch of different markers, a bunch of different medications out here on this graph, on this chart. Immune cells, cancer cells, how we're trying to attack cancer cells. These have all been possible because of clinical trials. And therefore, that is why we say clinical trials are important. So again, very common question, where can I find a clinical trial? Talk to your doctor. You can, if your doctor's office does not have a clinical trial, ask yourself to be referred to a cancer center or a larger institution, a university, where clinical trial offerings are done. You can look up on clinicaltrials.gov. You can also find a list of clinical trials for gastric cancer specifically on the DDF website, and this link has been provided here. What other treatments can be offered in a clinical trial? So Dr. Sharif had mentioned about the umbrella of immunotherapy, and we talked about, we kind of all are kind of aware of the terms pembrolizumab, nivolumab, or Keytruda, Opdivo. Going beyond those, we have oncolytic viruses. Now, these are basically viral particles that have been re-engineered to kind of demonstrate properties or have properties to kill cancer cells. and they're injected into the cancer to kill cancer. So those are oncolytic viruses. You have cancer vaccines. So you get vaccination for flu, for pneumonia. Similarly, now we have vaccines that are being developed for treatment of cancer. You have CAR T cells, and this is something that a lot of people are looking forward to, trying to see if they would be eligible for CAR T trials. And we will have a survivor experience here who has gone through a CAR T trial experience to see what their experience was. But essentially, what is CAR T cells? It's a more complex way of resetting your immune system. You imagine today, as Dr. Sharif had pointed out, how in our body, our immune cells have been blinded, which is why we cannot recognize cancer cells. This is just another way. You are just restoring a whole new set of cancer cells in your system. So you're taking the immune cells from an individual's body, sending it to a lab, re-engineering them to kind of demonstrate properties that can now kill cancer cells, and then inject those cells back into the patient and hope that these new cells will now replace the old cells and continue to kill cancer cells for a longer duration of time. That is essentially what CAR T cells are. So this was a paper published a couple of years ago now. This is from a CAR T trial specifically for GI malignancies, more specifically for gastric cancer and pancreatic cancer. That was completed in Asia. There is an ongoing trial in the US. The results have not been published. So these are results from the Asian trial. You can see here about 28 patients were enrolled onto the study. And a lot of these patients had received 2 or more prior lines of treatment given in the red box there. And if you see here, we talk about adverse events. Adverse events mean side effects from treatment. Grade 3 is where the side effect would end up leading to a hospitalization. And you can see about 37 patients ended up having these serious side effects. Low blood counts, anemia, low platelet counts are some of these side effects that were observed. Cytokine release syndrome, when we're resetting the immune system, the existing cells that are there just do not like it. And they somehow try to overcome those new immune cells. And the manifestations of that are called cytokine release syndrome. So such kind of symptoms were not observed in the study, which is a good thing. Some minor symptoms like fever, chills, rigors were seen, which was self-limited. And no treatment-related deaths were observed. You can see the response rate was about 57%. So 16 out of the 28 patients had a response. When we talk about response in a clinical trial, you want to have a 30% or more reduction in your tumor volume. That's what we're looking for. And that duration of response, you will see with about 53 months, or 6-month duration of response for about 53%, sorry. I pulled out a list of some of these novel clinical trials that are ongoing currently that do enroll gastric cancer patients. You'll see a lot of these are meant for different cancer types, but do have a cohort for gastric cancer patients. But the first 3 are vaccine trials, which I had briefly mentioned. And the last 2 are the CAR trials. The second to last one is the Claudin 18.2. Dr. Sharif had mentioned about this new biomarker emerging in the gastric cancer space. That's the CAR T trial against Claudin 18.2. And you have a CAR macrophage trial for HER2 overexpressing gastric cancers. I'll kind of stop at that, and we'll take a small break after this, and then we'll come back with some more sessions and then breakout groups for you to interact one-on-one.